Hi, I'm Kurt Lazarus, and I'm the Director of Operations for HV Health and Safety. And today I have with me Dr. Holcombe. He is our Medical Director, and Tatum Gillespie. She is our new Industrial Hygienist. So today we will be talking about silica and the effects on our bodies and the effects it has on employers throughout our industries. All right, first we'll start with what silica is, right? We have to understand what it is and so we can understand how it affects us and how we can better protect ourselves against it. So Tatum, can you kind of fill us in on what silica is, where it comes from?
Sure. So silica is a naturally occurring mineral found in the Earth's crust. So that means the most common industry we're going to find that in is mining, because obviously they're going into the Earth's crust, drilling for certain materials and things. It's definitely becoming a bit of a bigger issue in M&M mines, or metal non-metal mines, but we can also find it in other industries. Another big one is like in countertop making, manufacturing, and really any processes that involve like drilling, transportation, anything that's going to give off silica dust into the air.
And we breathe in silica, right? So we call that respirable silica, and that affects our bodies, right? So
Absolutely, yeah. Silica dust is an extremely irritating dust that when it gets into the lungs causes significant inflammation and over long periods of time, scarring and chronic lung disease. Things that can really impact your quality of life and how long you live.
Yeah, right. Historically, we have focused on things like black lung disease that you see in coal mining operations, right? Everybody knows what that is. And most recently, with the introduction of new MSHA standards, right? We are focusing on the metal non-metal mines, which is everything but coal mining practically, right? With that, there are a bunch of new requirements. Some of those are collecting and monitoring data, right, on silica in the environment. How are we doing that right now?
Sure. So there were a lot of updates made in the MSHA new rule. On the industrial hygiene side of things, the most notable one is probably that the permissible exposure limit, the PEL, has been lowered. So that means that the employers are going to have to focus on making sure that they are in compliance with that new PEL in order to abide by MSHA's rules. For monitoring, something that industrial hygienists can be doing at this time would include personal monitoring of the workers and area monitoring of the area to test for the amount of silica dust in the air and make sure that those are staying under the PEL.
Yeah, and so from what I understand, silica, because it's a dust, that we'll be able to see it, right?
No, not always.
Okay, tell me about that.
So silica can be a very fine dust. It can also be present on larger dust. So yeah, if you see a large plume of dust, that would be that would contain silica. But it can be also very fine as even 2.5 micrometers. We call that particulate matter 2.5 or PM 2.5, and that is so small you can't see it, and it's so small that it actually, when you breathe it in, gets down into the farthest reaches of your lungs, and that's where the most serious damage occurs.
So you're saying the respirable silica is stuff that we probably can't even see. The stuff that's going to hurt us it's invisible, right?
That's correct.
Which is why it's really important to do IH monitoring, because they're going to collect that dust and measure it in a way that is understandable and perceivable by an employer to protect their workers. So with this invisible dust that we're not seeing, that's hurting us, right? How are we determining if we've been exposed to that?
Yeah, so the first step to providing medical surveillance for these exposed employees is to test them, and we typically do that in several different ways. So the first way would be with pulmonary function tests, looking at how much they can breathe out, and we record that with a NIOSH certified technician performing those tests. Another way is to get a chest x-ray. And we can do that portably and on site. And those chest x-rays are read by a certified NIOSH B reader who is trained and licensed to read those chest x-rays, looking specifically for silica-related issues. But most importantly, the way that we check for silica-related disease is through a good history and physical exam. So examining the patient and taking a good questionnaire, looking specifically for respiratory disease in them, so things like shortness of breath and chronic cough and other respiratory-related complaints, and then providing a very focused exam looking at their heart and lungs and other major body organs.
Yeah, great. So when we're talking about x-rays, I mean, we get these big x-rays and, take them on site somewhere to look, I mean, how does that work?
No, so we've been able to find a x-ray company that has a very nice portable x-ray system that is high quality, that is used throughout the country and looking for, that has been historically used to examine for tuberculosis and tuberculosis screening. And so we're able to use that and achieve the same level of fidelity and high quality images that you can get in the clinic, out in the field on site.
Yeah, and from what I understand, we are one of the first, if not the first, to be able to do this on site, to go out to these remote locations and mines that typically would have to send their workers off to remote works or remote clinics, right? That could be an hour, 2 hours, or further away, costing money and time and loss of production. So this is a really valuable service that we're bringing to our clients, kind of state of the art.
That's correct, yeah. Being able to deliver the clinic to the job site and see the patients, the employees on site is really incredible. It allows for the employees to be seen that day and to get back to work. And so you're reducing lost work time, you're improving the compliance because you're able to capture those employees right there as opposed to waiting for them to go out to the clinic. And so really it's a win-win for the employer and the employee.
Yeah. At HV Health and Safety, we are committed to leading the industry by example, offering comprehensive solutions that not only meet but exceed current standards.